everyone, Lina here with Medicare Mentor. Today I want to provide you with some education about Medicare Part D. I put together a list of 7 questions that always come up when I'm speaking to Medicare beneficiaries. So let's get started. The first one is, what is Medicare Part D? Okay, so Medicare Part D is the prescription drug plan benefit that's going to help you subsidize the cost of your prescription drugs. Now, this benefit or this Medicare Part D is actually offered by private insurance companies that Medicare has approved already. Okay. Second question, who is eligible for Medicare Part D enrollment? Well, that is anybody that has Medicare Part A or B and is entitled to drug coverage, and it doesn't matter based on your income or your health or the amount of medicines that you take. They're not going to take that into consideration. They're just going to, want to know that you are eligible through Medicare because you have A or B. Okay. Next question. When do I need to sign up for Medicare Part D? First off, you do not need to sign up if you have a credible coverage through like an employer plan or a retirement plan. You won't need to sign up. Now, if that doesn't apply, then you do have 3 different times where you can sign up for Medicare Part D. The most beneficial time, or the most, that most time that people enroll, is actually during their initial enrollment period. And this is 3 months prior to their 65th birthday and up to 3 months past your 65th birthday. Now, you do have also an initial enrollment period when you first sign up for Medicare Part B. Okay, so that's the first one. The second one is during a special enrollment period, an SEP, okay? Now, a special enrollment period is going to come up when you lose the coverage that you had in place, maybe through your employer plan, or you moved out of your coverage area, okay? And when that special enrollment period is awarded to you, you're going to have 60 days to sign up into a Medicare Part D coverage plan, okay? Last is your annual election period. Now, during the annual election period, Medicare beneficiaries can go ahead and sign up, and this runs from October 15th through December 7th every year. And that coverage is not going to begin until January 1st. Okay, so you had the initial enrollment period, the special enrollment period, and the annual election period. Let's move on to our next question. What if I don't need a prescription drug plan because I take no medicines? I don't take any prescriptions. What do you advise there? Well, my personal advice is that even if you do not take any prescriptions at the time, you should enroll when you're eligible to do so. And there's 2 major reasons. Number one, nobody has their health guaranteed. Okay, so your health could change at any time. And if you didn't sign up for a prescription drug plan when you were able to do so, when Medicare allowed you to do so, they're not gonna all of a sudden allow you to enroll simply because now you need the coverage. Okay, they're gonna make you wait, and so now during this time you're gonna actually gonna have to come out of pocket full cost for the cost of that medicine. Okay, so that's the first reason I advise to do it when you have the eligibility to do so. The second reason is Medicare will penalize you for not having the adequate prescription drug plan in place, okay, when you qualify for it. And the penalty is 1% of the national average premium for each month that you went without credible coverage, okay? So for every month that you did not have a prescription drug plan in place, whether it's 5 months to 20 months, whatever the time is, they're going to penalize you 1%, okay? And then that cost is going to tag on to the cost of your plan when you finally do select the plan. And unfortunately, that doesn't go away. For as long as you have Medicare benefits, you're going to have that cost attached, that penalty attached, okay? So again, do enroll when you're eligible to do so, okay? Now, before we decide on selecting the prescription drug plan, I do advise always to have these 3 pieces of information before you decide, okay, what am I going to choose or anything else. Have the list of your medicines, okay? Have your full list, also known as your formulary, because you're going to be asked that information, okay? And then once you do have your formulary, you're also going to make sure that you have the dosage and the quantities that you take for those prescriptions. Okay, and last, have an idea of what is your pharmacy of choice. Where do you want to go pick up your medicines? Or perhaps, I prefer doing mail order. Have that in mind. Now, with individuals that do decide to go with mail order, sometimes you do get to save a little bit more on your co-pays, okay? Because it's, 3 months at a time, and you save money that way. Next question. We're at question 5 right now, okay? Where can I enroll in Medicare Part D? Well, the obvious, not the obvious, but one of the places to enroll is actually by calling Medicare, okay? And the number's right here, and it's 1-800-633-4227. Now, you could also find this number on your Medicare card, okay? So that's one way to enroll. The other way is actually going online and going directly to www.medicare.gov, okay? As you see here on the slide, www.medicare.gov. In a few minutes, I'm actually going to go into the Medicare website, and we're going to go through a plan together, okay? Just so you have an idea of, what it entails, okay? But before I do that, let's move on to our next question. Question 6. Which plan is right for me? Now, the plan that is right for you is based on several things, okay? And I've put it together into like one word just to help me remember, and maybe it'll help you remember, okay? And it's your yearly loop, okay? So loop, what does loop stand for? Well, it stands for your lowest out-of-pocket, okay? So that is the plan that's right for you. The one that's going to cause you to have the least out-of-pocket costs, okay? Now, obviously, that's different for everyone because not everybody has the same formulary, okay? So it's not really based on the company, alone, but, the overall lowest out-of-pocket cost, okay? Now, let's go over to the Medicare website, and we're gonna do a plan together. We're gonna go into like if we needed to enroll, okay? And I'm gonna go ahead and talk you through that. So let's go to Medicare, www.medicare.gov. Okay, so here's the website, and once you log in, you see Medicare that right there. And you see those 3 little boxes. We're going to go ahead and select the first box, okay, this first little green box right here where it says find your health and your drug plan. So let's go ahead and click there. Okay, next we're going to go ahead and enter our zip code, okay, because that's what it's asking us for. So let's enter our zip code. Okay, so the zip code that I entered, there's several counties associated to it. So we're going to go ahead and select the county, one of the counties. And then it's going to go ahead and ask us, okay, I'm going to go ahead and select Original Medicare. And for that bottom portion, I'm going to select I don't know, okay? That bottom portion talks about extra help, individuals that qualify for extra help or qualify for a Medicare savings program. Right now, I'm doing this like I have no idea whether I qualify for extra help or Medicare savings program. And actually right here on Medicare.gov, you could find out what extra help is and how do you qualify for Medicare savings program. But right now, we're not addressing that. So I'm going to put I don't know. And then next, I'm going to go ahead and enter some prescription medicine, okay? And I went ahead and selected 5 that I see a lot of individuals, I mean, not a lot, but, I come across these often. So I just selected 5, okay? So the first one we're going to go ahead and enter is Lisinopril. Okay, there we go. So you see it automatically comes up because Medicare knows all the formularies, all the medicines. And I'm going to go ahead and select that I take 10 milligrams and I take 1 per day. Okay. Next, I'm going to go ahead and enter Atorvastatin. Okay, here we go. Calcium. Okay, there it is. And there I'm going to select 10 milligrams, also 1 a day. Okay, let's move on to our next medicine. And now I'm going to enter levothyroxine. Okay. And with that one, I'm going to go ahead and select 100 mcgs, also 1 per day. Okay, let's add that one. Next, we're going to enter Novolog. Okay, with the Novolog, I'm going to enter the FlexPen. Okay, there we go. Novolog FlexPen, and that comes in a 3 milliliter, and it's 5 pence, and so I only selected that one quantity. And then last, I'm going to go ahead and select hydrochloroside tab. Okay. And then I'm going to go ahead and select 25 milligrams, also once a day. So there it is. There is my formulary, let's say. And you see this little square at the very corner? This is very important, okay? This is where you could, I need you to make sure that you save your drug list. So go ahead and write down that number. And then that password date is also important. And the reason why is whenever you come back to this website, medicare.gov, you're always going to be able to pull up your formulary as long as you have that drug list ID and you have the password date, okay? So and you could change it, you could update it, you could do anything that you need at that point in time, okay? And then next, we're going to go ahead and select our pharmacy of choice. And I will be selecting CVS and Rite Aid. Now, if I don't see my pharmacy of choice, like in that first little drop down, because right now I'm covering a certain miles, I could add additional miles and it'll give me like a wider span, okay? Okay, now I will select prescription drug plans with original Medicare, okay? So it's that first option. There's two other options there, and those options actually are for Medicare beneficiaries that are deciding to go with a Medicare Advantage plan, and that's not what we're doing. Right now, what we're going through is individuals that are on original Medicare, just A and B. And so let's continue to plan results. Okay, so at the very top you see original Medicare, and some of the information listed there is a little outdated because the cost of Medicare Part B is a little higher than what it is, but everything else on this website is going to be up to date. Okay, Medicare is very good about making sure that the formularies according to each company are updated, and so, you know, just that part is not correct. So based on the formulary that I entered, Medicare is saying, well, the plan that is going to provide you with the lowest loop, okay, with your yearly loop, lowest out-of-pocket cost is going to be SilverScripts, okay? And let's focus on the screen a little bit. It's going to see here SilverScripts choice. It's going to tell me how much the monthly premium is going to be. It's going to tell me what my estimated annual pocket cost is, whether I go with retail, mail order. And if you do decide to go with mail order, like from the get-go, you know you're going to go with mail order, just change the sort and now sort the plans by lowest estimated annual mail. So let's try that. Okay, lowest estimated annual mail order. And as you see there, Medicare went ahead and told me, oh, SilverScripts is no longer your best option. It's actually this other carrier, okay? Because you're going to save more money with them if you do mail order. So that's also important. Now, as we see here, the plan, and I'm going back, okay, so SilverScripts, as you see here, the plan that I'm selecting has no deductible. Now, only because your plan that Medicare's putting in first place for you has a deductible does not mean that you're going to be paying more. It just means that after they calculate the deductible and just your formulary, that is the best plan for you. And so with a deductible or without a deductible, that's still going to be the lowest plan for you, okay? Sometimes not having a deductible and going with a plan with no deductible and your formulary is not part of that other plan might cost you more, okay? We see here that all of our drugs are on the formulary. We don't have any restrictions, and the plan is rated 4 out of 5 stars, okay? Now, if you want to know how those plans are rated, why 4 out of 5, you see this little question mark, just click it there and it's going to tell you what is being considered when the plans are rated. Okay, let's move on. Now let's look at the actual plan. It provides us with the name of the plan, the phone numbers for members and non-members. Now, if you are going to enroll in this plan, you would obviously call the non-member number. Okay, and here we see the full cost of the drugs and what our co-payments will be for each medicine. Now, before we go into the difference between, you see here for month 1 through 7, at least with the formulary that I entered, it costs a certain amount in co-pays, and then the other 5 months it's a little higher. Before I go into why that is, let's scroll down. And here shows me all the tiers for the medicines that I entered. So prescription drugs are tiered from 1 through 5. And if your a specific medicine is a tier 1 or tier 2, that's just, it's probably, it's mainly generic or maintenance drugs, okay? Now, tier 3 to 5 are brand names and specialty drugs. You know, they're a little bit more costly, so your copayment is going to be higher, okay? Now, as you see here during the initial coverage level, the medicine is lower, and that's because you're paying 25% in copays and the plan is paying 75%. The coverage gap, which is the rest of the months, is what is also known as the donut hole, okay? So here, yeah, the donut hole. Unfortunately, they've associated such a wonderful food, donuts, with such a horrible thing. Yeah. But yeah, that's a donut hole, and I'm sure you've heard about it before. So here's the next question. What is the donut hole? And I'm sure you have friends and family that have brought that up, and if you don't, then you're going to learn about it. The donut hole is a gap of coverage, hence the hole. Now, in 2017, when the drug cost that is paid between you and the plan reaches $3,700, you go into a gap of coverage, the donut hole. And during that gap of coverage, you're going to be paying 40% for brand name drugs and 51% for generic drugs. And once the plan, both you and the plan have paid a total of $8,071.60 in prescription drug costs, then yay, you get out of the donut hole. And then you go into catastrophic coverage, where now you're only paying 5% and the plan is paying 95%, and so your co-payments are lowered a lot, okay? So, you know, and again, not everybody's going to go into the donut hole because not everybody has high-tiered medicines. You know, if you do, you may go into the donut hole in comparison to how the cost of your other medicines are, so it's different for everyone. So we've come to the end of our Medicare Part D education. I hope you found this informative. I hope it kind of cleared some of the questions that you had in your head. And if you have any additional questions, please feel free to give us a call here at Medicare Mentor. We look forward to speaking with you, and share this information with your friends and family. Let them become educated as well, and give us a call. Bye.